Welcome to the On Record podcast, a podcast where we talk with professionals and subject matter experts from diverse markets that are using video and audio in innovative ways to support their organization's objectives. My name is Mike Anzalone, and my co-host is Andy Simmons. Today, our guest is Mark Jones. Mark is the Director for Simulation Technical Operations at the Center for Medical Simulation. Welcome, Mark.
Thanks, Mike. Great to be here.
So before we dive in, why don't you tell us a little bit about yourself, your history, and your journey in terms of using video throughout your career?
Sure. Yeah, I started out, I was a wedding videographer. That's how I supported myself when I played in bands. And I started out carrying a handheld video camera with a battery pack. I follow the evolution of video, the downsizing of video, the evolution of resolution, and so forth. After videotaping and being a field videographer, I got into editing, used one of the first nonlinear editing systems from Panasonic. So I did video editing and digital format for a number of years. I also did a lot of live event support as an AV tech. Started in simulation around 2007. First system that we were using was basically recording to mini DV recording cassettes. And then slowly DVRs came into the picture, and then you were getting turnkey systems. And I dabbled with some of them, mostly to varying degrees of satisfaction. Some of them I found that probably the vendor was more interested in their agenda than serving the client. And a lot of the systems had latency built into them. The resolution wasn't very good. They were dependent upon the networks of the facility that we were in. A lot of times there were security issues. There would be patches made. Things would come along. So it made for a very situation where it wasn't as reliable as it could be. So therefore, there was some degree of trepidation with the end users, whether this was going to work or not for their event. So that led to some dissatisfaction and kind of putting things in the parking lot, not using technology because people were afraid of snafus and they didn't want to go down that road. So that's where kind of left off in simulation for a while. So going from there, things got a little bit better, but I am not a proponent of mannequin-based or mannequin manufacturer AV systems that are part of their ecosystem. So having a fixed ecosystem where everything has to work together within that ecosystem, and it's not a video agnostic or system agnostic approach. I don't really advocate for those type solutions.
Mark, I know the Center for Medical Simulation is a very influential organization providing training for other organizations, healthcare organizations, literally across the globe. But I think a lot of our listeners may not necessarily be familiar with healthcare simulation. Could you talk a little bit about simulation and the role of video in simulation?
Simulation, the word itself is a very broad word. And what simulation may mean to one group may not mean the same to another. So within our space, we are working with clinicians, anesthesia residents, and anesthesia attendings, and some labor and delivery folks. So within that, we will record them in a scenario being typically something goes wrong in the OR from an anesthesia standpoint or a patient standpoint, and there has to be a reaction or some way to remedy the occurrence. So within that, now we're looking at how the participants communicate with one another, how they approach the situation, and just teamwork in general. So throughout the video, we may notate various points discussion points And that leads to what they call video debriefing. So a lot of times we'll just play that and we'll let that participant see how they performed or what their actions were and let them comment on it. So that's one of the ways that we use video and medical simulation. But to get back to your original question about what is medical simulation, what is simulation, it's, is it, early nursing? Is it early students? Is it more mature learner? So there's a whole spectrum, and there's a whole different approach and application depending on the learning cohort. So it's difficult to just give a straightforward answer on it.
Yeah. Many folks that I speak with, when they talk about the value of video, they kind of always have this saying like, oh, the student or the learner had this aha moment. Have you experienced something like that in your work?
Sure, I think most of us have, but it's unless the person verbalizes that it's an aha moment, we don't really fully understand what that moment means to them. So that's a kind of a slippery slope and can be a bit presumptuous from the educator's standpoint of what the person's really thinking. Are they really thinking that, or are they just putting on a good face because they're not feeling good about themselves, or they have some apprehension or other emotions that they're not really ready to share. So when we talk about a psychologically safe environment, one has to ask, does video lend itself to psychological safety? Does it support it? Does it detract for it? Does that depend on the learner? So on and so forth.
Could you walk us through an example of how video may have achieved a specific educational outcome with your clients?
Well, I know you just used the word specific, but I'm I'm going to speak in generalities here. But I will say, one of the things that we talk about in our work at CMS is shared mental models. And shared mental models is when we're working as a team, how do we approach a given situation, and what sort of thought processes and value system do we bring to that particular situation? By recording this, we're able to capture how the group performs. Now, individuals may have preconceived notions of how they're going to perform, how they think they approach things, and their ability to handle situations. But a lot of times when the video plays back, they see themselves in a way that they didn't understand. They, intellectually, they have one perception of themselves, but the video presents maybe a different view that causes them some degree of reflection. And that's perhaps where the aha moments happen, or create moments of reflection. And that's where the learning can take place.
Interesting. Kind of on a different topic on video, I know you've been involved with designing video systems, putting them together. What's a common misconception about implementing a video system that you like to dispel for our listeners?
Well, like before this call, believe it or not, I did some homework and I prepared myself a little bit. There's so many factors. I actually have 2 pages here that kind of relates to that. So for me, a misconception is that you have to have video debriefing, and it's that really is subjective to some, and so this hard and fast rule, and I think there's a debate within simulation whether you need it or you don't need it, but it does depend on the cohort, with a group of learners. So the applicability is can be dependent on what your objectives are. So that's one misconception I think comes to mind readily for me.
How about from a technology perspective?
In what sense? A misconception?
Yeah, misconception. Oftentimes, I think people in organizations think, oh, video is easy to capture and replay, but when it does come to from a practical perspective, I think they might find it's completely different. And so I'm just kind of curious again from your experience. I'm sure you've been presented with last minute challenges and things that kind of go bump in the night and you need to fix them. And it comes down to, how can you utilize the technology in such a fashion to, again, achieve your specific objectives?
Sure. And that's a good question, because there are so many components and variabilities to using video in simulation, and using it in many settings, not just simulation. But I think people underestimate the time considerations that are required to utilize video. So one of the things that typically happens is there'll be one tech, and they'll be asked to run the mannequin, they'll be asked to run the camera, they'll be asked to go get coffee, you name it, it comes up. So how do you prioritize? And so when a tech goes to a group and says, this is the equipment I need and this is why I need it, and getting the folks that make the decisions from a financial and technical standpoint, uh, getting them to have that buy-in. It's like, if you're going to, if we're going to be a low resource environment, then these are the things that you can do to help me. So I think if you're going to use video, the first thing on my list that I wrote is, usability. How intuitive is the system for the users? Will they be able to initiate and navigate easily? So if you're asking people to do things outside their comfort zone, you've got to be able to present a tool that's approachable. Like, I couldn't take a car apart, but I can get in it and press the button and drive away. So if you take that kind of model and apply it to design into video, making the barriers to entry less onerous, like making it accessible for folks. So that's really important. And like doing things like, if you're going to use cameras, making sure as the vendor, when you go in, or whomever is in there, like, no cameras pointing at windows, thank you very much, or having subjects against a window. We don't want backlit situations. Helping, being in a partnership with the client and the end users, understand their level of competence with the stuff, and helping them understand the pitfalls that can happen. So if now in the modern day and age, most video is conveyed over IP, or, so if we're using a network, letting them know if they can avoid it, stay off an institutional network, create your own ad hoc peer-to-peer network. So your equipment is communicating with one another, with each piece of equipment, using cloud-based situations. So you create your own ecosystem, and folks will be able to tap into that. We'll avoid some of the latency issues. We'll avoid some of this, what I mentioned previously about security patches and things that come along unbeknownst to the end user that they happened. Oh, and you get an email. Oh, I forgot to tell you. Yeah, we did an update last night, and the cameras are going to be offline. It's things like that. These little tripwires that are out there that people don't realize that are there.
Well, Mark, going from a wedding videographer to the high-tech space of healthcare simulation, I'm sure you've seen like a whole bunch of trends come and go, but where do you see video going in terms of not only the technology, of course, but how it can be applied?
Yeah, I've been reflecting on this recently when you asked me about this podcast, and thinking about my own use of video and trying to be proactive and understanding where technology is going, and what kind of compatibility and opportunities to leverage synergies exist. So we talk a lot about AI, and we talk a lot about VR, and AR and VR. And so, yeah, now we have a VR session with someone, but they can see what's going on. But how can the learners, the rest of the learners that are watching, or this session happen, how can we capture that? So how can we have this interoperability amongst various platforms and make it meaningful and useful to the rest of the learners, so they're not just standing by watching someone go through something? Because one of the issues with VR, it's like maybe if you're lucky, you have 3 systems and 3 sets of glasses, but you've got 20 learners. So as each person goes through their session, now you've got this throughput, and what are the rest of the learners doing while that's happening? So just trying to think about those environments and how we can be a little bit more proactive with that. So that's one thing that I've been thinking about from a more forward-thinking standpoint. Currently, I tend to follow the educators and listen to what they're trying to accomplish. So, form follows function. How do we create a solution for what they're trying to accomplish? How do we work in the partnership with them, and not standing on protocol or dogma as far as, well, we don't use video like that. Well, you're not really part of the solution if you're not willing to create these partnerships with the educators. So it's really important that not only the tech, but the educators understand that's mutually beneficial to have that partnership and be proactive. And from a tech standpoint, like, I'm not an educator. Like, well, you can support this more and feel like you're adding more to the efforts, and it can be, gratifying. Besides just like, the tech kind of mentality that you get in simulations sometimes.
That's interesting. Have you run across situations where the learners in your center are hesitant to be recorded on video?
Yeah, I think that's I think that runs across most spectrums. You run across people all the time that don't want to be in the photo, or they don't, they're just reluctant. Maybe they're introverted. Maybe they've had issues. Maybe they're shy for whatever reason. You have to respect that. But part of it is, it's really up to, in my view anyways, the educators to kind of handle that and to govern that, and say, there's an expectation that we're going to be doing these exercises, and it may involve video. Like, if you just can't do this, what recourse do we have? If you're uncomfortable doing that, I mean, maybe maybe you just can't be in this program. I don't know what it is, but certainly we don't want to inflict any kind of emotional trauma on anyone, because we're hanging our head. I mean, you must be on the video. If they can't handle it, they can't handle it. So that is one of those things where I think it's you handle on a case by case basis, and you just try to work to diffuse the situation, to encourage the learners, but not coerce the learners, and just say, this is what we'd like you to do, and we think could be beneficial. We can make it private if we need to. You don't have to share it. So really trying to work and stay flexible within the time that you have available to allocate towards helping individuals.
Well, Mark, it's obvious you are quite the expert in using video, and if you were advising someone who's just beginning to explore video for training, for education, for learner performance assessment, things of that sort, what 3 principles or ideas would you share with them?
Well, people get tired of hearing this from me, but I'm a real big proponent of form follows function in design, and really understanding your mission, what it is that you're trying to accomplish with video. So once you understand that, then the format is going to follow that. the equipment is going to follow that. The approach, the scenarios, and any number of things are going to flow from that. So that is, to me, is the biggie. Second is asking oneself, is there a value add by using video in this circumstance? So it takes a lot to build, to set up, to script, to whatever you're going to do with it. Sometimes we don't know until we try, and we say, that just didn't come off the way we thought it might. So sometimes you have to try it. But again, that partnership that I alluded to earlier, being able to have discussions with folks and help them think through the dimensions of they ask, what are you asking of me or of this situation? And with what we have for resources, is it going to be practical? So those are two. And I think, finally, and this ties into the other, is a couple of things. Is like, someone may say, we want to videotape a mass casualty drill. Well, that's great. You've got one tech and you've got one camera and you're trying to cover 1,000 square feet, in a dim room. How are you going to do this? What kind of resources you're going to need. So being able to communicate requirements to people, again, in a respectful, professional way, to make people understand that you're not saying no, you're trying to explain how are we going to execute your satisfaction so it doesn't undermine the effectiveness of your program. Or sometimes you're better off not doing it because you can't do it well. And you don't want to diminish your impact. So those are some of the things that I would be discussing. But I mean, I want people to understand that, there's still a level of enthusiasm. Like, it'd be great, yes, we want to do this. We want to succeed in spite of obstacles, not fail because of them. So we want to be able to, yes, we're in your corner, but let's really look at this and examine this before we go too far down this road.
Yeah, that's great advice. Before we wrap up, any other thoughts that you'd like to share with our audience?
Yes. There's still, at this point now, we're way past the early adopter phase of medical simulation, but yet there's still a lot of areas where simulation centers are being built. And there was this traditional paradigm of what a sim center should be. We're going to have an all-purpose room with 3 beds on the wall with head-end units, and we're going to have fixed cameras installed, and this is going to be our space. And then people are locked into that. So it's very important, in my view, when designing a sim space and thinking about video within that space. It's like, how do you maintain versatility of space, of the education, of the whole technical mission that you're asking for, and how can you potentially the dollars that you have available, you want to do this installation, how are you going to be able to support it? It's one thing to buy the gear when people build the sim center. They get this grant, great, we got $1 million, but they didn't get the second grant, which is in perpetuity, that supports, staffing the sim center. And it's not just all volunteers, because most of us that are in this field have been in situations where we get somebody in and they're all gung-ho to be part of the sim center. They last about 3 months and then they leave. And I'm not talking about a full-time employee. I'm talking about people that in various professions that want to be part of it within the medical field. And they get into it and they realize this takes a lot of our time. So it's having people understand that you can't count on that. So when you're designing something, understand the realities that you have. This is what our staffing is going to be. I need to build around that things that I can easily access and implement as we move forward, and so they don't take away so much of the time that's available for the educating part, and it's a distraction. And the equipment is not so complicated that it just gets overwhelming when you're trying to train new people that are these aforementioned folks that are coming in, rotating through. you want to be able to do it in a way that's pretty straightforward. And, one of the things that I do like about some of the discussions we've had about your equipment, and I'm not singling anything out, but you and I have talked about offline about having your video system be able to function also as your audiovisual system. So how can you have your equipment serve multiple purposes? And how can you be able to move it around and be agile, scalable, that a la carte menu to procurement. So if you want to add to the system, you can as you move forward. So you have the ability to expand it. It's mannequin agnostic. You can bring in any mannequin you want, and it'll be able to interact with that. You'll have interfaces that allow you to pretty much interact with anything. The other part is, can you do some sort of learning management stuff with it? So all these components that go into a sim center, especially when you're using it for an evaluative process, how can you capture this data? How can you make the dollars that you have available to spend on technical equipment? How can you deploy them in a way that gets you the most value and practicality for the money spent? So those are things that at times I find not enough thought goes into them. A lot of times, the architects working on our system are working on our sim center. Well, great. What do the architects know? They know how to build a building. What do they know about the technical end? So how do you get the stakeholders? How do you align the stakeholders to make sure that interests are being represented or met, and there's a clear understanding of what that mission is? So this whole process of teamwork, community, and all the stakeholders coming together to make sure that this is a success, because you get one shot to do it. So I'm, really sensitive to that, and I've seen it where it has gone off the rails, like beautiful center, but no one uses it. Well, why? And you, as you can walk through it and you can see why.
So it sounds like not only is the technology and the design of the technology important, but you can't eliminate the human element as part of the entire operation.
That is correct, Michael.
Well, this has been a phenomenal discussion, Mark. I really appreciate it. How can our listeners get in touch with you?
Well, I am on LinkedIn, and I can be reached via email at mjones@harvardmedsim.org. If anyone does want to reach out, I'll do my best to get back to you in a timely fashion. Sometimes I do have things going on that can be a little overwhelming, but I'm happy to share, whatever information I can, and, just be supportive to, fellow folks in simulation.
Well, thank you, Mark. We really appreciate your time.
You're welcome, Michael.
All right. Take care.
On Record is a podcast presented by Intelligent Video Solutions, hosted by Mike Anzalone and Andy Simmons, and produced by Kyle Shellstad. Find us online at ipivs.com/onrecord and on social media at Intelligent Video Solutions.